Welcome viewers to an in-depth look at histoplasmosis, a fungal infection primarily affecting the lungs. This video will explore the causes, symptoms, diagnosis, treatment, and prevention of this disease, equipping you with the knowledge to understand and manage this potentially serious condition. Join us as we delve into the world of histoplasmosis. Histoplasmosis is caused by the fungus Histoplasma capsulatum. This fungus thrives in soil, particularly soil enriched with bird or bat droppings. Common sources include caves, old buildings, chicken coops, and areas under roosting birds. Infection occurs when microscopic fungal spores are inhaled. Disturbing contaminated soil during activities like construction, farming, or even cleaning can release these spores into the air, making them easily inhaled. Once inhaled, Histoplasma capsulatum spores travel down to the lungs. Here, they transform into their yeast form. These yeast cells are then engulfed by immune cells called macrophages. The yeast can survive and multiply within these macrophages, essentially using them as Trojan horses to spread throughout the body. In most healthy individuals, the immune system effectively controls the infection, walling off the yeast cells in granulomas, small clusters of immune cells. However, in those with weakened immune systems, the infection can spread beyond the lungs, leading to disseminated histoplasmosis. Histoplasmosis is most prevalent in the central and eastern United States, particularly in the Ohio and Mississippi River valleys. This region is considered endemic for the fungus. However, cases can occur worldwide. While anyone can contract histoplasmosis, certain groups are at higher risk, including infants, young children, the elderly, and individuals with compromised immune systems due to conditions like high VIs or immunosuppressant medications. The symptoms of histoplasmosis can vary widely, depending on the amount of fungus inhaled and the overall health of the individual. Many people exposed to the fungus experience no symptoms at all. Others may develop mild, flu-like symptoms such as fever, cough, fatigue, and chest pain. In more severe cases, especially in individuals with weakened immune systems, symptoms can include shortness of breath, weight loss, night sweats, and even organ involvement, leading to complications like liver, spleen, or bone marrow damage. Disseminated histoplasmosis can affect virtually any organ system. Diagnosing histoplasmosis can involve several methods. A doctor might order a chest X-ray or CT scan to look for lung abnormalities, such as granulomas or infiltrates. Sputum samples, or samples of fluid from the lungs, can be tested for the presence of the Histoplasma capsulatum fungus. Blood and urine tests can also detect fungal antigens or antibodies. In some cases, a biopsy of affected tissue, such as lung or bone marrow, may be necessary to confirm the diagnosis. A histoplasma antigen test is most sensitive in disseminated disease. Histoplasmosis can be broadly classified into a few categories based on severity and location of the infection. Acute pulmonary histoplasmosis refers to a lung infection, often self-limiting in healthy individuals. Chronic pulmonary histoplasmosis typically affects people with underlying lung conditions like emphysema, resembling tuberculosis. Disseminated histoplasmosis is the most severe form, occurring when the infection spreads beyond the lungs to other organs. Each type demands a tailored approach to treatment. Treatment for histoplasmosis depends on the severity of the infection. Mild cases often resolve on their own without any treatment. However, more severe cases, particularly disseminated histoplasmosis, require antifungal medications. Common antifungal drugs used to treat histoplasmosis include itraconazole and amphotericin B. The duration of treatment can vary from several weeks to several months, depending on the severity of the infection and the patient's overall health. Supportive care, such as rest and fluids, is also crucial for recovery. While it's impossible to completely eliminate the risk of histoplasmosis, there are steps you can take to minimize your exposure to the fungus. Avoid activities that disturb soil in areas known to be contaminated with bird or bat droppings. If such activities are unavoidable, wear a respirator mask to prevent inhaling the spores. Wetting down the soil before disturbing it can also help to reduce the release of spores into the air. Prophylactic antifungal medication may be considered for highly immunocompromised individuals living in endemic areas. The prognosis for histoplasmosis is generally good for individuals with healthy immune systems. Most mild cases resolve without any long-term complications. However, in individuals with weakened immune systems, the prognosis is more guarded. Disseminated histoplasmosis can be life-threatening if left untreated. Recent research is focused on developing more effective and less toxic antifungal medications. Studies are also exploring new diagnostic methods to allow for earlier and more accurate detection of the infection. Further research into host immune response is also being conducted.